Welcome to Medical Marijuana and Wellness. Today's topic is getting started with medical cannabis, important for folks that are new to medical cannabis, and candidly, some folks that have been in medical cannabis for a while. This can help them understand how to maximize or get the best relief from the cannabis product that they're using. Joining me today is Amy Green, RN at MMTC of Florida. Welcome, Amy.
Hey, always great to be here, Marc.
Thank you. Let's dive in and let's help folks figure out what cannabis is really all about. Tell me what we're going to talk about today.
Yeah, today we're going to be looking at the actual cannabis plant and understanding how it works in our body as medicine. And then what is a medical marijuana product? And we'll go through the different types of products that you might see, along with creating a regimen that's going to work for you. And then we're going to talk about journaling and starting that self guided dosing process to figure out exactly what's going to work for you.
Great. So let's take a look at what a medical cannabis patient looks like. I know when people talk about marijuana, you immediately think of people like Snoop Dogg and Willie.
Yeah, they are the quintessential stoners. So,
But what's interesting is when you take a look at, in reality, the folks that you see in the clinics on a daily basis, Snoop Dogg and Willie has kind of migrated into turning their names into brands. But what you're really seeing is you see seniors, you see veterans, you see athletes and professionals.
absolutely. I encounter many people that are literally just trying to get through their day and they're looking for a medication that they can use that will help with the conditions that they're trying to treat in a holistic and easy way to do that.
Right.
We're just trying to help them find relief.
Sure. And medical cannabis is really no longer socially taboo. In fact, it's increasing with respect to being accepted as a healthy alternative. Now, let's talk about that a little bit because if using medical cannabis is safe, no one has ever died from the use of cannabis, whether that's recreationally or medically.
That is 100% true. So if you say you buy a medicated chocolate bar and you accidentally eat the entire thing because it is delicious, you will have several hours of being very tired, very hungry, and having a stoned or heady feeling. All
Mhm.
of those things go away with time, and there is zero chance for overdose with any cannabis products.
hmm And this is from the World Health Organization. So let's talk a little bit about what is cannabis? What is marijuana? What are the main components of it?
Yeah, so when we think of cannabis, everybody thinks of THC, maybe CBD. Now, those are cannabinoids. THC and CBD are just two of many cannabinoids. There's over 80 that have been found. CBD and THC are going to be the major cannabinoids, and then there's lots of minor cannabinoids as well, like CBG or CBN.
Mhm.
Then you have terpenes. Terpenes are what give cannabis its smell and its taste, and they also provide a lot of the medical benefits for cannabis, like the anti-inflammation, pain relief, anxiety relief. For example, linalool is a terpene. It's also found in lavender. And when we think of lavender, it's a very relaxing scent. It's naturally occurring, and we also find it in cannabis.
Yeah, the
And then
fascinating
you
part
have
is that many terpenes that people who use essential oils essentially are using terpenes.
Absolutely. That is totally correct. Now, flavonoids, very similar to terpenes, they're going to provide color, aroma, and taste to the cannabis plant. And they're also going to be providing really helpful benefits, antioxidant, anti inflammatory, and possibly even disease prevention.
Sure. And when you put all those together, you get something called the entourage effect. That's really important.
It is. So the entourage effect is when we've put the cannabinoids, terpenes, and flavonoids together, like you would have in the full plant, and it's how all of those different parts work together. So, for example, you have CBD, it lessens the psychoactive effect of THC, and then terpenes work to enhance the effects of cannabinoids and flavonoids, and then you have THC and CBD also work incredibly well together to enhance the benefits of each other.
What that means is that if you have a CBD product by itself or a THC product by itself, it does work. But when you put them together, in essence, one and one is three, it really helps you boost the medical benefits of using those particular products. Let's talk about why cannabis is such a big deal. Why marijuana? Well, what we know is that we know we have a nervous system. Since we were born, we knew that if we hurt our hand, our foot, we have a problem with our stomach. The nervous system, which I call the cell phone system of your body, basically communicates to your brain and says, Houston, we have a problem. For years, medical science has been trying to figure out what the brain does with those particular signals. What they found out was when they started studying cannabis is that every person has what they call an endocannabinoid system. That endocannabinoid system is a series of receptors inside the body that help your body to be able to manage itself. So when you say, Houston, we have a problem, the endocannabinoid system takes over. And what it does is it helps producing endocannabinoids to help regulate your memory, your emotion, your appetite, sleep, your temperature, your body temperature, inflammation, and the immune process. And these CB1 and CB2 receptors are pretty important, aren't they?
Absolutely. So we generally find the CB1 receptors in the brain and in the spinal cord. And then we find most of the CB2 receptors in the periphery of the body. So we'll find it in organs and then throughout the rest of the body. Now, CB1 is really important for anything that has to do with mood, anxiety, pain perception, and CB2 really important for anti-inflammatory and also pain control.
Yeah, and that's really, really important. Now, what we're talking about here is why it's important is because our body is producing endocannabinoids. And when you're a senior citizen like myself, or just a person in general, what you may need is you may need more endocannabinoids to address your particular condition, like if you have an operation, or if you have sort of an injury, or you have some sort of a medical condition, you may need to have more endocannabinoids produced by your body. So how do you supplement that? Well, what they found out was the cannabis plant produces what they call phytocannabinoids. Those phytocannabinoids have a pretty interesting characteristic, don't they?
Absolutely. So, endocannabinoids, it's what our body is naturally producing, endo meaning inside, and then phytocannabinoids are what would be coming. What we would be consuming from the cannabis plant. Now, the phytocannabinoids are actually identical to the endocannabinoids that our body is naturally producing. So, when we are introducing phytocannabinoids into our body, we are, in a sense, supplementing our endocannabinoid system. Say, as we get older, our body is naturally going to produce less endocannabinoids. So we are supplementing that naturally occurring system to help bring it back into balance.
Yeah, and your body staying in balance is called homeostasis. The key is cannabis working with your endocannabinoids helps your body basically manage itself. And that's why a lot of people get the relief that they're looking at. And it's also done naturally. You're really introducing a medical component that is identical to what your body's producing. And that's one of the reasons why it's so safe. Let's talk about a medical cannabis product for a second. There really, when you look at a cannabis product that you're going to use, it has different components. Why don't you take me through this? Because there's routes of administration, types, potency, and terpenes.
Absolutely. So, routes of administration is going to be how you're actually going to ingest or take that product. That can be smokable flower, vapes, edibles, topical products. There's a wide variety of ways to introduce cannabinoids and THC and all parts of the cannabis plant into your system. Now, for product types, you might find products that are only THC or only CBD, or they may be a ratio of those products. You might also find products that have
And
added.
we should point out that most products that are being used for medical cannabis are really ratioed products.
They really are. And the most common ratio that you would find is a 1-to-1, which would be equal parts THC and CBD. Now, potency, lower THC, higher CBD products. That's going to have a lower potency of THC and a higher potency of CBD. That's going to lessen the potential of the patient having that stoned, heady feeling because there's slightly more there's slightly more CBD than THC.
It's like when you go to a liquor store and you're looking at the alcohol content, this is exactly the same kind of thing. How potent is with the particular product that you're using?
Correct. Yeah. So then the terpene content is how much of these naturally occurring compounds are available in that product. This can range greatly from very low concentrations of terpenes to very high concentrations of terpenes, just depending on the specific product, whether it is a flower or a vape pen or an edible or a tincture.
Now, one of the very interesting things is that here, and we're using a medical cannabis program or product from a state program that they're getting their licenses from, they all have to have what they call certificates of analysis. And this is very, very important. Why don't you take us through this? Because if you're going to pick up a product, in this case, a vape pen, Tell us about the different components that you can actually find.
Absolutely. So, in at least in the state of Florida, any product sold in a medical marijuana dispensary, they do have to be able to provide you a certificate of analysis for any product you wish to purchase. So, when we're looking at this certificate of analysis, we see right up at the top, it's telling us what that product is. So, that is a vape pen. So, this is going to be cannabis oil that is heated and then inhaled into the lungs. So that's what a vape is. Next, it's going to tell us the product type. So we see that this is an indica product, meaning it's indica in the couch. It's good for relaxation or trying to go to bed. And we also see the ratio of CBD to THC. The standard form that you'll see this in is it will be the first number, colon, second number. The first number is always going to be CBD, and then that second number is going to be THC. So this lets you know what ratio you're going to have. And then when we're looking at the potency of this product, we're seeing that there's 73.6% THC, 8.35% CBD. That's roughly a 1 to 9 ratio of CBD to THC. However, we can also see that this product does have some minor cannabinoids. That's the CBG and the CBN. They're also very important cannabinoids. They're just not in such high concentrations that we would put them down as a main part of the product. Now, when we're looking at terpene content, we can see that the overall terpene percentage of this product is 4.73%, but that 4.73% is actually made up of all of the different terpenes that are in that product. So we can see that there's 1.19% beta myrcene, but then there's also just over 1% limonene. Now it's the total terpene content that we're looking at, because those terpenes are really what's going to be providing a lot of the medical benefits for this product.
Yeah, and even though that terpene number is small, these are very potent. You're going to find if you have, even if you get as high as 5 or 7% terpene content, that's a very potent product.
That is a very potent product, especially for products like flour. You'll find terpene content as low as 0.5% and as high as 5%. So from
Right.
0.5 all the way up to 5%. So you can have a huge variety of potency of terpenes as well.
And anytime you go to your medical cannabis dispensary, you can ask for this particular COA on any product that you're looking at, as well as purchasing. I suggest you do that so that you know exactly what you have. And by the way, you can match those terpenes to your particular condition. Now, we went over routes of administration really quickly. There's different ways of taking it, and you can actually mix and match these. Why don't you walk us through a few of these? Because a lot of people start with sublingual.
Yeah, a lot of people do start with sublingual products. Those are generally going to be tinctures, which is a cannabis oil product, and it comes with an eyedropper. And those drops are meant to go under your tongue, hold it in your mouth for a minute, swish it back and forth, and you're meant to get absorption underneath your tongue and along your gums. These products have a faster onset time than something like an edible or a capsule, because you are getting some sublingual absorption, but it's nice because they generally last a pretty long time. So it can be a really great product to start with, especially because they're very easy to dose.
Take that eyedropper and you can use a quarter of an eyedropper, a half an eyedropper, something like that. You can experiment with the amount of product you're taking.
Absolutely. Similar would be a spray product. So this could be a nasal spray or a meter dose inhaler or an oral spray. These products, unlike a vape, the sprays are not heated, and so they can be a little bit easier on your lungs and your chest if you do inhale some of it when you're spraying.
Famous oral products. This is where you get into your gummies and your lozenges. This is a lot of fun because we hear a lot about these things, a lot about these products, and they taste pretty good, but they have an interesting onset time. Why don't you explain why that is and what you have to be careful of?
Yeah, absolutely. So anything that we are swallowing, generally most of the absorption is going to be done in our gut. So the onset time is going to be very delayed depending on how fast our bowel motility is. So that's how fast things are moving through our bowels. Um, Patients that have a faster gut may notice a faster onset time. That said, we have to remember that the onset time for these products can take up to 2 hours. So you have to be very patient with them.
Yeah, I think the old saying is about the time you think that it's not working and you take another one is about the time it starts kicking in.
That is so true. Now, I do caution newer patients with capsules, and that's just because generally with capsules, you can't change the dose. So you just want to make sure that it's a dose that you feel comfortable with.
Sure.
And then with edible products, you just want to make sure that the dose that you're taking, again, is one that you're comfortable with. You have to decide, do you want to take the whole product? Do you want to possibly cut your gummies into halves or into quarters? If you're going to use a product like a mint, what is the strength of that mint? So with edibles, there's a lot of different things to consider besides just what flavor do I want.
Yeah, and as you mentioned earlier, you can take a lot of the like whether the brownies or the gummies and things. You can actually cut them in half initially and try that out. But the real key to using edibles and oral products is be patient because it's going to take a while to work. It could take an hour, 2 hours to work. And what you don't want to do is eat them like Skittles and then not feel very well a couple hours from there because you're having some of the side effects that you may or may not want. Let's put it that way. Tell me a little bit about topicals because topicals
Yeah.
are great as far as being able to help, especially with pain relief.
Absolutely. So, generally, you're going to find two different types of topicals in our market. One is going to be just local relief wherever you put it. So, you wake up, your knee hurts, put some on your knee. It's only going to help your knee. The other kind of topical is going to be what's called a transdermal topical. So, you wake up, put some on your knee. It's going to help your knee, but then it will go through your skin and into your bloodstream and actually provide medication throughout your whole body.
Mhm.
So the transdermal topicals, very similar to the transdermal patch.
Mhm.
Now the patch is generally meant to be worn for anywhere from 8 to 72 hours, and it's meant to give you a low, consistent dose for that entire period of time. But
Mhm.
you have to remember, because it is transdermal, it will go into your bloodstream. So
Yeah.
even though it's a small dose or a low dose, you still want to make sure that it's a dose that you feel comfortable with.
But the nice part about patches are that you can actually take them off, and within 20 to 30 minutes, it reduces or it eliminates the negative side effect that you might be feeling.
Correct, absolutely.
Now, let's talk about the famous inhalation because really, when you talk about inhalation, you're talking about really vape pens, flower, and concentrates. Let's start with famous flower because I think everybody looks at flower as a potential alternative. Tell me about using that from a medical cannabis standpoint.
Yeah, absolutely. When we talk about flower with medical cannabis, that's the green leafy material that everybody thinks about when they hear cannabis or marijuana. It's the most classically available form of cannabis. Most people, when they use flower, are going to roll a joint, put it in a bong. They're going to smoke it. They're going to light it on fire and inhale the vapors that come off of that. Now, the problem is you lose a lot of the efficacy of flower when you light it on fire. What that means is that as soon as I light it on fire, a lot of those terpenes, cannabinoids, flavonoids, they burn off instantly before I've had a chance to pull them into my lungs. And so it's actually not the most efficient use of cannabis products.
Also, when you take that blunt and you light it, you have that 500-degree temperature that burns off a lot of those cannabinoids and terpenes and flavonoids. You also have a burnt material going into your lung, which is
Absolutely.
something you may want to be careful of.
And just like with anything you're inhaling to your into your lungs, you just want to keep in the back of your mind everything that is in that product, including any of the byproducts of actually lighting it on fire.
Vape pens are really put together because what they did was they took that dry flower, put it into in essence an oil, and actually have the vape pen do the burning, which means if vaping, you're not burning and you don't get those burnt material.
Absolutely. So when you're using a vape, whether that is a disposable vape pen or a vape cartridge, what you're doing is that product is just cannabis oil. There's nothing else added to it. So it's just cannabis oil, and then the battery is heating up that oil to the point where it vaporizes, and then you're inhaling that into your lungs. So you don't have any of the byproducts of combustion, and it can make it a little bit easier on your chest and your lungs.
Right. And some vape pens have temperature settings, and we'll talk about why in a minute to really take advantage and really enhance the terpenes that are there. But really, concentrates are where they take the cannabis product and put it into different forms. They call it shatter, they call it wax, rosin, whatever it is. But the reason people do that is because what they want to do is they want to take advantage of the terpene. And things like rosin and resin are something that are full of the whole plant products. You're getting all the cannabinoids and all of the terpenes with those particular products.
Absolutely. Concentrates are definitely going to be the strongest product that are available. However, they usually have the highest concentration of cannabinoids and terpenes together.
So that's where they basically come into play. And most importantly, what you want to take a look at, and when you want to get involved in medical cannabis, pay attention to the terpene profile. I know a lot of people say, well, what strain's going to work? Forget the strain. You want to pay attention to what terpene works for you, because once you get the right terpenes, then you can match it to the strain and get the relief that you're looking. Now, there's about 120 different terpenes that are out there. We picked the top 6 because this is kind of the all-star list.
It really is. These are the ones that you're going to see most often when you're looking at a certificate of analysis. And as we go through the different terpenes, you can see that they all provide different benefits. So with, for example, limonene, you can possibly an elevated mood. It might relieve stress and anxiety. The nice thing about limonene is it's going to have that fruity or citrus smell to it. And that's how you know that a product has a lot of limonene. It's going to have that very citrusy smell.
Now, the interesting thing that we
Absolutely.
talked about the temperature is it's a low temperature product, meaning that if you get above this temperature range, above 400 degrees, you might burn off the limonene. And like you said, when you light that blunt, you light that joint, that it's got a 500-degree temperature, you're definitely getting rid of the benefits of limonene.
Absolutely. And so that's where something like a vape or a lower temperature use of a product can be really beneficial for getting the full range of terpenes.
Yeah, the vape pen gives you temperature ranges you can set low, medium, and high. Same thing with a lot of the concentrate product that you use, the devices that you use let you set that temperature range, which is really what you want to do. You want to take advantage of the terpenes. Tell me a little bit about pinene, because pinene is great for really helping with pain relief.
Absolutely. It's also really great for stress and anxiety, inflammation, and it's actually a bronchodilator, so it can help open up the airways. And it has been shown to possibly improve short term memory. The cool thing about pinene, this is that really deep forest pine smell that you might get with conifer trees, rosemary, basil, or orange peels.
And then linalool is actually helps you relax with your stress and anxiety.
Absolutely. Just like we said before, this is what you'll find in lavender. And this is what we think of when we think of lavender is that relaxation and that stress reduction. And it can be a little sedative. So it can help you relax. It may also help with insomnia and improve the overall quality of your sleep. And it has that floral, kind of spicy, musky smell to it.
And basically, almost every product cannabis product out there has a certain element or a certain amount of myrcene.
Absolutely does. Myrcene is one of the major terpenes. It's been known to have antibiotic, anti-inflammatory, analgesic, which is pain relieving, and it might also help with relaxation or be a bit of a sedative. And it's also a muscle relaxer. It can help with stress and anxiety as well. And myrcene is that smell when you smell mangoes or lemongrass. It's a little bit of a fruity smell to it.
And caryophyllene or beta caryophyllene is one of the most important products that you're looking for, not only inflammation, but also pain relief.
Absolutely. That analgesic is pain relief. It can also help with antidepressant effects, relieving stress and anxiety, and it may augment some types of chemotherapy, meaning it may make them a little bit more beneficial.
Kind of lessen the negative side effects of that.
Correct.
And one of my favorites is eucalyptol. For a whole number of different reasons, it really helps with a lot of different conditions.
Absolutely. So it's again analgesic. So it's that pain relief. It can also be antifungal, anti-inflammatory. Can help decrease blood pressure. May help decrease blood pressure, I should say, and improves cognitive functions for those with dementia. Eucalyptol is going to be that really fresh, minty smell that you're going to get with tea tree, sage, bay leaf. So it's that really deep, minty, fresh smell.
And like we mentioned, these are only 6, the all-star 6. There's over 120 different terpenes, and this is where your medical marijuana doctor, as well as your dispensary, can help you identify the terpenes that can help you with address your particular condition. But really an important part of this is dosing. How much do I take and when do I take it? Now, cannabis has what they call a biphasic effect. Can you tell me a little bit about this?
Yeah, absolutely. So when we're talking about a biphasic effect, we're talking about 2 effects. So the first effect is going to be when we are coming up in that low dose to that target range. And so that is the effects that we want. Those are the positive effects. So that's going to be your pain relief, your anti-inflammation, your relaxation, a little sedation to help you go to bed. Those are all the positive effects that we're looking for as we try and reach that target range.
What's interesting about cannabis is when they say start low and go slow, the reason for that is because you want to, for example, if you're using a tincture drop, start with just, let's say a little bit at the bottom of that eye drop, maybe a quarter of the eye drop or a half. Do that for a day or two. Find out if you're getting relief or not. You'll find out, you'll start using it, increasing every day or two more of the use of that product, and you'll begin to feel the relief that's there. The reason for that is because every person's body is different. Just like with alcohol and just like with caffeine, every person has to really identify, because cannabis is such a personal product, again, like caffeine and alcohol, what works for them and what their tolerance level is.
Absolutely. And it's about finding that correct dose for you, because a dose that works for one person is absolutely not guaranteed to work for another person. And so it's finding that very specific, low effective dose that provides you the benefits that you're looking for without unwanted side effects. And when we talk about unwanted side effects, that's when you get into the other side of that biphasic dosing. And that means that we can take too much. Now, even though it says toxic, there are no actual toxic or
There's nothing in there. There's nothing in there that's going to kill you or really hurt you. Feel by toxic, you may get dizzy. You may feel that stoned effect. You may feel a high effect. Obviously, if you're beginning to feel that way, stay away from driving and things like that. But in many cases, a lot of folks get so relaxed they really hit the couch rather than go out and run around the block.
Yeah, absolutely. And when we get into that toxic range, just like you said, that's when you start to get the negative side effects. So that's when you're going to have possible anxiety because you took too much. You might have an increase to your pain because you took too much and you're outside of your target or effective dose. So it's really about finding that very specific dose that's going to provide you the effects you're looking for without unwanted side effects. It's just going to take time and trial to figure out what that dose is.
Usually this takes about 2 weeks. Although there are conditions, things like, for example, Parkinson's, that could take maybe 2 months because of the
Absolutely.
type of thing that's there. But as you listen to your body, I always get the question of what should I take and how much should I take? And the answer is I can't tell you, but I can tell you who can. It's your body. Your body will tell
Absolutely.
you as you're taking a little bit more, you begin to feel the relief. You'll get this relief with no side effects. You'll take a little bit more, and all of a sudden you'll say, well, I'm not comfortable. I'm feeling a little dizzy or something like that. Back down. Go back to where you were before, to where you had that relief with no side effects. That's your therapeutic dose, and you'll know that. In my case, I had pain, and when that pain went away, it's like, whoa, where did that kind of come from? Your body will tell you. Listen to your body. That's where you'll be able to figure out what your therapeutic dose is.
Absolutely. And part of being on this journey is keeping track of what has and has not worked for you. So that's the self-guided dosing part. All right, so let's put this all together.
Yeah, let's put it all together, Amy. So let's go over here and take a look at this. This is a chart that you can get from the medical marijuana treatment. This is a link. You can actually download it from the medical marijuana treatment clinic. This is a form that you use on a daily basis.
This is, yeah, I really recommend this to all of my new patients. It's going to help you keep track of what's working and what's not working for you, and to really be objective about how those products are working for you. As we go through the journal, I'll just point out some parts. So it's just how you're feeling beforehand, what symptoms you might be experiencing, and you kind of assess how you're feeling before you take any products. And then you get into what product you're actually taking, information on that product, what's the THC percentage, what route are you using. Now, here's the part that I think is most important, and that's why it's blown up a little bit here. The dose, how much you took, what time you took it, when you first started feeling the effects, and then how long those effects lasted for you. If you don't use any part of this journal other than that one line, that is probably the most important line to keep track of, to figure out what's an effective dose, how long or how often you might have to take a product, and then what product is working for you. So
I know that when I had a left knee replacement, and when I was going through the post-surgical, trying to get the pain relief, what I found out was I thought that I'd need a high THC product to address the pain. What I found out was I needed a high CBD ratioed product because it reduced the inflammation, and the inflammation reduced the pain. That's where this
absolutely.
dosing really, when I looked at that and I saw the pain relief I was getting for high CBD products versus high THC products, it became black and white the direction I should be heading.
Absolutely. And when we look at, below the dosing line, it has what are the effects that you're experiencing when you're using that product. So is it making you feel calm? Is it making you feel like you're locked into the couch? Is it giving you any euphoria? Does it make you feel sleepy or relaxed? And then finally, you have to look at symptom relief. Is that product helping with the symptoms that you were trying to treat in the first place? You know, if you had nausea, how did it help with your nausea? If you have pain, how is it helping with your pain? If you suffer from insomnia, how did it help you sleep? How did you feel in the morning? Being reflective about how the product is working for you is a huge part about figuring out exactly what's going to be the best products for you.
And this is something that can help you quite a bit, being able to identify not only the products, but how those products work for you. Because the bottom line is you want to get relief from that medical condition, and that's what it's all about. And I should point out, there is a YouTube channel that we have that has a whole webinar like this, or a whole video on just dosing. So Amy, let's kind of wrap this up. There's a number of resources people can use if you want to get yourself a medical marijuana card. MMTC, which you work for, is available.
Absolutely. MMTC, we have over 20 clinics across Florida, and we're always here to assist our patients and even potential patients with any questions about medical marijuana, help with their card, and just guiding them along this process. We're always available for our patients.
And I think the most important part of why I like to work with MMTC is you have a free call center. So after you get your card, you have a call center that can help you be able to really take advantage of dosing and get the most out of cannabis. And also you get monthly emails, a couple of emails a month to help you walk you through that whole journey as you're going through medical cannabis. So the bottom line is MMTC equals support, which a lot of other medical marijuana doctors really don't provide. And then also, if you want to take a look at a CBD product, you have My Botanical Wellness, because a lot of CBD products are not regulated. This is a site that has been put together by doctors to be able to provide products that were in fact tested. And then we also have some education like this video that we're doing here with our YouTube channel.
These are wonderful resources to either help you decide where you want to go for your medical treatment, or to just find out more about medical cannabis and how it can help you.
One of the videos that's available is how the Florida Medical Marijuana Program works and the regulations and things like that. Amy, we've talked a lot about getting started. Any final thoughts?
Just remember that start low, go slow. You can always take more, but you can't take less than what you've already taken. And then keeping a journal is going to help you with figuring out what specific products are working for you and how often you might have to take them to meet your specific needs.
Cannabis is a very personalized product. You have your unique condition, you have your unique body. You're able to use the dosing and being able to use the guides, like which terpenes to be able to use, to be able to just dial in that product to really address your particular situation. I know that in my case, pain was key. Being able to dial that in, relieve my pain, and be able to continue to live pain-free is really, really important. I want to thank everybody for watching this. Please like and subscribe to our YouTube channel. We really appreciate it, and we look forward to your feedback on this particular video. Thank you very much.